All right. It's really nice of you to give us this time. I really appreciate it on the behalf of the WFNS Spine Committee. But we'll just start with your story first. So why did you choose neurosurgery?
I think in many ways, neurosurgery chose me and I didn't choose it.
Ah,
I, when I started college, I very quickly became interested in human behavior and animal behavior, but then it very quickly evolved into the chemistry and the pharmacology of behavior. And through college, through my master's degree, through my PhD, I was always doing some neurochemistry related research, always related to the brain actually. And so then when I got to medical school, it really very quickly evolved into either neurology, psychiatry, or neurosurgery. And having grown up as a carpenter, for me, working with my hands is very enjoyable. So neurosurgery was the obvious way for me to go.
okay, that's nice. So can you tell me more about your mentors that throughout your residency in neuro and spine surgery?
Sure. My two major mentors were Nell Roten.
Okay,
That was in the early years of my becoming an attending,
okay,
and my chairman at the University of Chicago was also a major influence on my career. That's Sean Mullen. But I
okay.
actually learned spine surgery from one of the attendings there. His name was Fred Brown. And it's very interesting how small a world it is. He taught me spine surgery. I later taught him how to do minimally invasive spine surgery. And he eventually operated on my son using the operation I taught him.
Wow. That would really work in your favor, didn't it? So basically, what I've read about you, and I know that you have been working on research in spinal cord injury treatment. So can you just tell me first, what inspired you to start this research?
In high school and college, I was a collegiate wrestler.
Mm-hmm.
And when I was in practice one day in college, one of my fraternity brothers and a close friend of mine broke his neck right next to me on the mat,
Okay.
and immediately became a C5 quad. So that was the initiation of my interest in what clearly was a devastating injury that can occur with so little of an impact.
Mm-hmm.
When I then became eventually an attending at the University of Florida, they
Okay.
had one of the leading spinal cord injury research teams in the United States. So it was just made sense for me to become involved in their research.
Okay. And that's a really inspiring story to go forward with this. So when did you exactly, well, you told me you started when you joined the Florida University. So like how far have you come since you started the research? Like how
Well, so
far has it gone?
our first research in humans was in the mid-1990s.
Mm-hmm.
At that time, we did not yet have stem cells. So the cells we transplanted were collected from voluntarily aborted fetuses.
Okay.
Um, Extremely controversial research at that time. And we were only allowed by the FDA to do implantations in chronic injuries in thoracic spinal cord because that was the safest way to do it. All of our original patients had syringomyelia, so they were going to undergo surgery anyway. And they
Okay.
consented to have a transplantation of these embryonic cells as well as have a drainage of the syringomyelia. In those early studies, we got very little in the way of positive results, partially because they were chronic injuries, some as long as 30 years old,
Mm-hmm.
partly because we were transplanting a very small volume of cells into giant syrinxes,
Mm-hmm.
and partially because it was thoracic spinal cord, and the cells don't grow far enough to really have an impact. Our last study, which we had finished recruiting for, but which we are still following, was in acute cervical spinal cord injuries.
Okay.
And we achieved remarkable recovery of function. 66% of our patients recovered at least 2 levels of function, which
Oh,
meant
wow.
they went from shrugging their shoulders to using their hands. And that's a life-changing recovery. So our last study was extremely gratifying.
That's amazing. I think since I've been a medical student, I've actually worked with spinal gunshot injuries, and I've always heard Dr. Salman talk about this stem cell research, and it's really, really inspiring for me to talk to you right now about it. I hope someday I get to get involved in it too as well.
So
Um,
what we've done
sorry?
with now is I've also recently established a basic science laboratory
Okay.
studying stem cell biology for spinal cord injury, and we are aggressively and actively looking for the next step, how we can make our results even better.
Wow. Can't wait to hear about it more. Um, so other than what do you think it's holding back the progression of spreading this treatment throughout globally, basically? I know like right now that it's very focused, this research, but is there any, do you think there's any particular obstacle that's coming in getting through?
Well, the obstacles, I think, are several fold. One is that it is such an incredibly complicated problem that to figure out how we can attack it successfully is really hard. You know, we basically have two arms, a inflammatory arm and then a regenerative arm. And sometimes when you decrease inflammation, you get a beneficial effect. If you decrease it too much, you get a deleterious effect. And there are many, many problems that face attempting to get cells to regenerate sufficiently to have a functional effect. So that's the scientific problems. Then there are government problems where, you know, our regulations are so strict, both on stem cells and on human research, that it is painfully slow to be able to do this research. But that's also very important because these cells can create tumors and we can injure patients just by doing the surgery. So we obviously have to be very careful.
Yeah.
But the barriers are substantial.
All right. Thank you. And so you've been awarded the Cabin Foundation for the Cabin Foundation Award for your contribution to the minimally invasive spine surgeries. So how do you think you have changed the face of spinal surgery now?
Well, certainly in the United States, many of the minimally invasive procedures that we've developed are now standard of care.
Okay.
For example, minimally invasive TLIF is one of the most commonly performed operations now. It's basically replaced the open TLIFs. I have not done a laminectomy for lumbar stenosis since roughly 1993. And the procedures that we have for it now are just vastly better. I can't imagine doing a laminectomy anymore. It's not even comprehensible to me. So I think we've moved the needle. I think we are moving toward the point when virtually all spine surgeries will be able to be done minimally invasively. For example, I do all my scoliosis minimally invasively now. It's had a monstrous impact on recovery and complications. So, you know, we've really moved the needle, I think.
That's nice. So basically, now that you told me last time you did like the normal open procedures were like many years ago, but do you think in your training, the training programs now, the residencies, should they be thought the minimally invasive procedures as normal procedures, or do you think they should require a separate training or a fellowship for the minimally invasive procedures?
It all depends upon the faculty that are at your institutions. If you have, for example, at Rush University, we have 5 dedicated spine surgeons. 4 of them do minimally invasive surgery. So a resident graduating from here doesn't need to do a fellowship. He's been doing minimally invasive surgery for 7 years. But if you're at an institution that doesn't yet have that, then you really do need a fellowship. And it needs to be a year long to really learn the techniques of minimally invasive surgery.
Okay. So do you think, do you consider that the worldwide management and surgical guidelines in spine surgery are useful at this stage, that you think like they should be using their local resources more, or there should be a uniformity or of the guidelines?
I think the uniformity of guidelines is good in one respect, and that it gives you a level to shoot for, you know, a technique, skill level set that will be beneficial to your patients. But not all places in the world have similar resources. So it shouldn't ever be used as a judgment or a punishment if you don't do minimally invasive surgery yet, but giving you something to shoot for to continuously improve your techniques. In that regard, it's helpful.
Okay. So now let's just come back to the young neurosurgeons nowadays. So what advice would you give to a young neurosurgeon who's interested in spine surgery?
Specifically, the advice to regarding spine surgery is to jump into it and do as much of it as you can. In many ways, technically, spine surgery is much more difficult than most of the procedures we do in neurosurgery. I would say, with the exception of an open basilar tip or a very complicated aneurysm at the bifurcation of the carotid artery or something like that.
That would be a bit difficult.
Surgeries are much more complicated than that. And you're also judged much more harshly on your results. If I'm doing an aneurysm and the patient dies, well, that was sort of expected. But if I'm doing a complicated spine surgery and the patient doesn't come out perfect with no pain, then somehow I failed. So if you're interested in spine surgery, you've really got to get in there. You've got to do as much of it as you can. You've got to be willing to learn for the rest of your life, because our techniques are changing so rapidly that if you stop learning, you become outdated very quickly.
That is definitely true. So now that you've given some advice on spine surgery, so what about someone who's interested in stem cell treatment? A young neurosurgeon who would like to get involved, what advice would you give them?
Well, if you really want to get into the basic science aspect of it, you're going to have to take some time off and get in the laboratory. And it would probably be 1 to 2 years to get enough background and experience that you would then be able to establish your own laboratory in the midst of your practice. But I'll be very honest, trying to do basic research in the early years of establishing your practice is extremely difficult, because they both are 150% of your time.
That's for sure.
And then if you want to have a personal life, a family life on top of that, it's really, really hard.
Okay, so coming to that point, how do you balance your priorities and your clinical work and your research work and then your family life? How do you deal with it?
Well, when I first started, after doing my PhD and then getting into medicine, when I took my first job, I did not do any basic research. I only did clinical research, and then much of this was the stem cell transplantation that we're talking about. It's only in the recent years that I've reestablished my basic science laboratory. Part of that is because my children are now grown and out of the house, so I do have time. But when I was starting out, my rule was that even though I was working long hours, when I came home, I was theirs. I was totally my children's time and my wife's time. I did not work at home until they all went to bed, and I would go back to work.
Oh, that's very nice.
Early on.
I'm sure they're very thankful to you for that. So recently, Dr. Salman told me that you spoke to him and you told him about there's a new game changer that you're working on. Do you want to shed some light on that?
Sure. About 10 years ago, I established my own company. It's an intellectual property generating company. So I invent things, and I patent them, and I take them to various levels of development and then sell them. I think the game changer that you'll be seeing fairly soon, probably within a year to 2 years, is I now have 3 lumbar stabilization systems that do not rely on rods. They're completely rodless stabilization systems.
Wow.
The cool thing is they can all be done minimally invasively. Because there's no rod, it's very inexpensive to manufacture. So this will be good for developing countries that can't afford, $7,000 constructs for every patient, because these will be pennies on the dollar. So I think not only for United States market, but I think for the international market, these are real game changers.
All right. I think we're going to look forward to that.
You don't need 3 trays of instruments. You only need a handful of instruments to put them in.
Wow. I think we're definitely going to look into that because we have a lot of this problem of money issues, finances with our patients. So yeah, I think it's going to be a game changer for our patients as well. So let's talk about you a little bit. What do you do for relaxing? How do you spend your weekends and time off?
Okay.
If you get time off.
A lot of times, I enjoy golfing. I exercise virtually every day. I'm an avid reader. I like to collect antiquities. I like whitewater rafting and snowboarding.
Wow.
And I like bird watching.
Wow.
So I have 2 ways to relax. One of the things I've done for 30 years is I have an in-ground jacuzzi at home.
Nice.
And before I go to bed virtually every night, I will go outside, whether it's summer, winter, 30 degrees below zero, whatever. I go out and do a jacuzzi, which relaxes me, and then I sleep very well. And for me, a perfect Saturday or Sunday morning is sitting at my kitchen table with a cup of coffee, listening to classical music, and watching all the birds in my bird feeders.
That's really nice. Sounds very relaxing too. So can you tell us a little bit about your family?
Yeah, I have 3 children. My wife's original career was opera. She was an opera singer.
Oh, wow.
And then later on went and got an MBA in business, and then just recently published her first book. So she's quite a multi-talented woman. My oldest daughter also became an opera singer, but then decided that she needed to make money. So she is now a nurse practitioner living and practicing in Houston.
Okay.
My son followed the same pathway I did. He did a PhD in neuroscience, in spinal cord injury, actually.
Wow.
And he then went to medical school, and he is currently in his 3rd year of residency in my program.
Oh, that's
so
nice.
My youngest is an artist living in Los Angeles.
Oh, that's a very variable sort of thing going on. That's really nice. So can you tell us what do you think about the WFNS Spine Committee and the progress it has made during the recent years?
I think the progress they've made in the last 3 years, for example, has been phenomenal. They are sponsoring courses all over the world every single year. They are collaborating with other societies to sponsor additional courses. They've got a great newsletter. They're putting out guidelines. They've been extremely active. It's a great group of guys doing really good stuff.
I think right now we have the symposium coming up as well in Pakistan. So kind of looking forward to that too. Is there any particular question you think we should be asking you, or maybe I've missed out on that I should know?
No, I think probably the only thing is I would encourage our young neurosurgeons to stay, up to date and pursuing their continuing education. Neurosurgery still is advancing so rapidly, and it's so exciting that I encourage anybody to go into neurosurgery. It's been a great career for me. I would do it all over again.
Me too. Thank you, Dr. Fessler. It was really, really nice talking to you. And I think I've been really looking forward to meet you because of the stem cell research. It's really inspiring for me. And we're all very grateful that you took out time for us.